Welcome to OrthoStatic, a product of the Academy of Orthopedic Physical Therapy. Welcoming our guest today, an accomplished educator and clinician, making strides in our profession of physical therapy with dual board certification in orthopedic and sports physical therapy. She is a recognized expert in our profession. Dr. Carey Rothschild, welcome to the show.
Thanks for having me. Good morning.
Good morning. All right, we're diving in this. A great overview or a macro, a zoomed out episode for the show. We wanted to create this because we want to start with the basics. We harp on that all through PT school and through our careers, which is make sure you know the fundamentals and the basics. So I think there's no question that's too simple and we should avoid asking it. So that's why my very first question is going to sound so simple. I think we agree with it's important to ask, which is, what is orthopedic physical therapy? And maybe how does it differ from other physical therapy specialties? I remember when I was just a student, I probably could name 2 or 3 different types of physical therapy, and then I got exposed to a whole lot more. So how do you answer that question in terms of what is orthopedic physical therapy and how does it differ from other physical therapy specialties?
Sure. I think it's a great place to start this conversation. I think that for orthopedic physical therapy, when you think about orthopedic, if you dissect the root word, you're going to get some information about Greek word meaning deformity, but ortho meaning deformity, and pedic meaning kind of as the body grows. But when we kind of zoom out and look at what it is, it's really dedicated knowledge and expertise in the musculoskeletal system. So we're talking bones, we're talking joints, we're talking tendons, we're talking fascia, and of course the neurovascular structures that accompany all of those body parts. So really it's the physical therapist that is dedicated to the musculoskeletal system and improving the movement and musculoskeletal health of an individual. And it's a little different from some of the other specialties. I think orthopedic physical therapy is probably maybe what the lay person might know most about.
Sure.
Coming into physical therapy school. Maybe they've had some physical therapy for a sprain or a strain or something like that. But there are a vast number of other specialties that include neurological, which focus on neurological injuries, such as stroke, spinal cord injury. And then we've got pediatrics, which focus on younger people. And we've got geriatrics, which focuses on the conditions of older individuals. And then we've got some unique specialties like cardiovascular and pulmonary and wound management and oncology and women's health. So I think orthopedics actually kind of falls in a little bit of all of those because, of course, we have kids that have orthopedic injuries and we've got older adults that have orthopedic injuries. So I think to start with that, musculoskeletal expertise.
All right. Well, if we're jumping into that, it feels like orthopedic physical therapy covers a lot of our profession, what people might think of physical therapy if they're not in the profession. So let's go with commonalities. What are the most common conditions treated by specifically orthopedic physical therapists?
Anything that has to do with a bone, a joint, a tendon, a ligament, a muscle, maybe nerve compression. I think orthopedic physical therapists see a lot of spine pain, primarily lower back, neck pain. I think we see different conditions of tendons like tendinopathies, overuse conditions. We also see lots of ligament sprains. So you think about an ankle sprain or an ACL sprain in the knee or a tear. And then we do a lot of work with post-operative rehabilitation. So once those structures are injured and they have to be repaired surgically, we're looking at the back end of that and protecting those surgical repairs and helping that individual get back to the things they like to do through a strategic musculoskeletal rehabilitation plan.
Let's talk about something else that I don't know if I was prepared for when I went into PT school, but it seemed to be everywhere, and that's evidence-based practice. Mm-hmm. Help us understand why evidence-based practice in orthopedic physical therapy might be so important.
It's very important. And I actually get a chance to teach orthopedic physical therapy in the DPT program that I am a professor in. And I think it's super important. Evidence-based practice includes the patient's preferences. It includes the clinician's expertise. as well as the best evidence from research perspectives. And I think the field of our orthopedic physical therapy is constantly moving forward. We have new evidence, new research that comes out on a regular basis. And so it's important to make sure that clinicians, orthopedic specialists specifically, are looking at this evidence and what does it say, what should we be doing for a lateral elbow tendinopathy, for example. And so some of the great work that comes out of the Academy of Orthopedic Physical Therapy, along with some of the sports physical therapy as well, is the clinical practice guidelines. And that's a nice summary of all of the best evidence to treat and manage different conditions. So I think we give the best care to patients from an orthopedic perspective when we utilize our own expertise as a clinician, and we also take into account the patient's preferences, but then we really back that up with some good research that is going to help improve the outcomes of the patient in the most efficient manner.
Well said. Let's move on to maybe the first contact that a patient might have with a physical therapist, and that's the initial assessment. What assessments are critical, and why is the initial assessment so important in orthopedic physical therapy?
As part of that initial assessment, first thing that a therapist needs to do is rule out any red flags. Those might be some things that are alarming to an orthopedic physical therapist that might warrant a referral to a different healthcare provider, kind of outside of the scope of what we could be able to treat. Another thing we want to pick up as an orthopedic specialist is some of those yellow flags, which are some of the psychosocial factors that influence the patient's condition. But ultimately, we want to get to the point of doing a good physical examination, and that includes doing some range of motion, some strength testing, some special tests, because the best we can do is finding the root cause from a pathological standpoint. We want to know what structures are involved, but we want to take into account all these other things as we look at the individual as a whole. We definitely want to make sure that we're doing the tests and measures that are appropriate for that body part, as well as given the time frame post-injury.
Now, you mentioned evidence-based practice, and that is terribly important in the research, but how might orthopedic physical therapists stay current with the latest treatments, the technologies? Things change rapidly. How do people stay up to date in the profession?
We are bombarded with information. I think one thing we do have is a plethora of resources. We've got lots of journals. We've got the Journal of Orthopedic and Sports Physical Therapy, which presents a lot of great content for orthopedic physical therapists, as well as the Physical Therapy Journal. Also has an orthopedic section typically every month. I think we've got lots of information coming at us from different podcasts, for example, from different YouTube sites, for example. We've got webinars. We've got constant ability to take continuing education now in a virtual format. I love getting emails that give me some new information. Oh, this new clinical practice guideline came out. I'm a podcast junkie, so I love listening to podcasts on my drive into work. I think those are really some great informational sources, as well as our professional organization and the Academy of Orthopedic Physical Therapy has got a lot of good resources on their website as well.
Good to hear that you listen to podcasts, being that you're on one. Finally, since this is a product of the Academy of Orthopedic Physical Therapy, again, as a PT student, I was exposed to the APTA as a student and started to figure out and learn all the different places around that one association that I could learn from. So specifically for AOPT, or the Academy of Orthopedic Physical Therapy, what do you think are some of the benefits specifically for a new grad physical therapist for joining something like the Academy of Orthopedic Physical Therapy?
I've been a member of the Academy of Orthopedic Physical Therapy for 25 years, since I graduated. I do believe that the Academy's website is continually updated. I think you've got access to people. So you can meet and contact different people that might be in a community that is aligned with something that you're interested in, like pain, for example. There's lots of resources. You've got access to the journal, access to clinical practice guidelines, access to the special groups, the communities as well. If you're interested in volunteering, there's ability to do that. You can find that through the Academy. And also, you can do some service and volunteer in some different areas that might be within that skill set you have, or something that you're learning and growing.
Yeah, it sounds like, to summarize, people, information, people, and opportunities.
Absolutely.
All right, we didn't prepare you for this, but I'm always confident that this never catches an educator off guard, because you always seem to have some words of wisdom. So the last thing we do on the show is called Words of Wisdom. What would you want to leave? What's one thought or sentiment you'd want to leave with the audience today as we wrap up?
So if you're interested in orthopedic physical therapy, I would definitely advise finding a mentor. I think the mentors are invaluable in whatever specialty practice you end up doing. But I think having a go-to person that can answer questions, help provide some guidance, and also give some good feedback, whether we want it or not, I think mentorship is huge. And so I would definitely put that as a little nugget to take forward.
Yeah, I'd like to give a nod to my mentor, who was my former professor, and now she hates when I call her my former professor. She says, you should just call me your friend, because we're still friends. But having that person who's maybe seen some things, or just maybe walked a little bit ahead of you in a career, to be able to suggest, because again, she won't give me any answers. She's a great educator. She won't give me any answers, but she keeps asking me questions to keep me on track. Carey Rothschild, we appreciate you coming by Orthostatic and sharing with us today.
Absolutely. Thank you.